this presentation, I actually put Boladé's photo on, so you can actually see. And this is really his work and his gifted analysis of secondary data. So Agatha and Aline, like my prior disclaimer earlier, it's very binary when it's speaking about sex. So this is about young women because of how they identified in these large-scale surveys. And we're really looking at three kind of data points that are important. Experiences of gender-based violence in the last year, mental health symptoms, and substance use in this group. And this is, I think we've heard enough during the conference and the workshop to know why this is an important topic. So what Boladé did in this analysis is to use these large existing data sets, which we're very lucky to have for Lesotho, Zimbabwe, and a few other countries, to try and see what were the links between young women who shared that they had experienced past year gender-based violence, and I'll explain how that was measured, and two related experiences to mental health and well-being, symptoms of mental health distress and substance use. And he first looked at all young women and then young mothers living with HIV. The analysis included over 8,200 18 to 24-year-old women, and they were about half from Lesotho and just a bit over half from Zimbabwe. You'll see that overall there are high rates of having lost a parent before 18. There's also 1 in 5 in Zimbabwe had been pregnant or had a child before 18. Rates of gender-based violence are between 1 in 7 and 1 in 5. And you'll see experiences of substance use and mental health symptoms in the right, so two sets of circles. 6% reported substance use and 1 in 5 any mental health symptoms. And there were some differences by country. So the analysis that Boladé did shows both by each country what was happening, and he also pulled the data together. So at the top, I'll walk you through these bars. If it's green, it means that a young woman, or the young women included there, did not report experiences of past year sexual abuse, physical or emotional violence in a relationship. If it's in red, they reported it in the last year. And if you go from the top, it's substance abuse, and we're thinking here about severe use of substances. We're not thinking just a little bit, though I can clarify how that was measured with Boladé. In Lesotho, you can see that the red bar, and in Zimbabwe really, are higher than the green bar. So what this means is that young women who experienced gender-based violence in the survey were much more likely than those who didn't to report substance use in the past 30 days. And you can see that those differences are also there in the bars at the bottom, with mental distress in the past 30 days. And this was similar for both countries, even though the rates are a bit different by country and when the data was combined together. Boladé and our team has been trying to understand what other factors may be making a difference. So he did this analysis including the young women's age, HIV status, their residence, rural or urban, their education level, whether they had early sexual debut, so sex for the first time before 16, Constance speaking to some of your points earlier, pregnancy before 18, experiences of orphanhood, and whether they were married. And even when all of these factors were included, experiences of past year gender-based violence were strongly associated with higher likelihood of substance use and mental health symptoms in both countries. And if you look, and this is the little black squares in the graphs, you can see all of them are to the right of the number 1. But if you're looking at Zimbabwe at the bottom, you'll see that having a pregnancy before 18 and being a young woman living with HIV is really a bit worrying. So not only experiences of gender-based violence, but also early motherhood and living with HIV, something is going on there. So Boladé did something that demographers are very good at and I am not good at, which is called population attributable fractions analysis, which tries to tell us how much of the issue can be explained by gender-based violence. So don't ask me very complicated questions about that. But when he compared young mothers living with HIV who had experienced past year gender-based violence to those who didn't, we see that there were 20% less likely to have mental health symptoms and 27% less likely to report substance use. So if we're thinking specifically about how we support young women living with HIV and those who have become mothers, it's really important to link violence prevention and violence response services to mental health support. And in some cases, you remember substance use was not very prevalent, but it was there in additional support. So just to summarize, past year experiences of gender-based violence in over 8,000 young women in Lesotho and Zimbabwe were associated with substance use and mental health symptoms. Particularly young mothers living with HIV were extra vulnerable, and we should think about what additional layers of support they may need and the timing of them. And it's really important to think about these and really have good models of how to do it. So I just want to shout out to our Zambia-based peer supporters. They're waving again. Who've been actually putting this into practice. So they've developed and talked to nearly 200 young mothers and young women living with HIV in Zambia to try and understand, how do you really ask about violence? Do you ask about mental health? Do you just assume that a young mother is really in extra need? And then how do you link to existing services in places where, you know, very, very highly specialized psychiatric or mental health support may not be available? Keep it up, everyone. Thank you.